And now for our student speaker for the class of 2021. During his time at Harvard, Russell Simons worked as a public health fellow in the office of Massachusetts State Senator Joe Comerford, drafting legislation to promote racial and health equity in policymaking across state government. Russell grew up in Larchmont, New York. He received his Bachelor of Science in Biology, magna cum laude, from Boston College as a Gabelli Presidential Scholar. He previously worked as a researcher at the Human Rights Watch, where he investigated human rights concerns related to the opioid epidemic, the development of universal health coverage systems, and HIV/AIDS care for transgender women. Russell is finishing his MD at the University of Chicago and pursuing a residency in general surgery. He is fiercely passionate about fighting health inequity in all forms and promoting social justice. Russell intends to use his training in medicine and public health to make a meaningful difference in his patients' lives and to play an influential role in U.S. policymaking. Russell, take it away.
Dean Kim, esteemed members of the faculty, and members of the classes of 2020 and 2021. My name is Russell Simons. I'm an MPH graduate of the class of 2020, and as of yesterday, I'm officially a Doctor of Medicine as well. Despite the craziness of the last 24 hours, I am so happy to be here with all of you. If you remember, it was almost 1 year ago, or for some 2, that we tuned into our virtual commencement exercises. Now that we're all here gathered for graduation 2.0, I think this officially makes us the only 2 classes in Harvard's 386-year history to graduate twice from the exact same program. In preparation for this historic graduation, I reflected on the remarks I delivered a year ago, titled, "Politics Are Public Health, Social Change is Medicine." I think, regrettably, that message is just as relevant today as it was last year, as our nation continues to find new and devastating ways to politicize the public's health. As I try to find my own role amid the seemingly unending chaos, I'm reminded of the most important change in my own thinking over the past few years. Let me explain. I've always thought of the Serenity Prayer as a sort of guiding framework for my life. For those not familiar with it, it goes, "God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference." Over the years, I've realized it's not all that easy to act on. I've often doubted whether I'd be wise enough to recognize what I can make better in this world, and whether I would have the courage to make it so. Prior to starting at Harvard, I spent the preceding 3 years as a medical student on Chicago's South Side, where I helped care for dozens of patients who, as best I could tell, had been sickened by the society in which we live. Patients were often labeled as complex because their social needs outstripped what we as caregivers could offer. I went home a lot of days feeling powerless to change the circumstances of my patients' lives, even though it was these social determinants that had propelled them to the hospital's doorstep with the momentum of accrued injustice. I imagine most of us can think of a job or personal experience that showed us the need for a more equitable and just society, pushing us in the direction of public health. Unfortunately, there is no pill for injustice, and the medical textbooks I was studying didn't talk much about politics, poverty, or structural racism. And yet I kept asking myself, if these are the things that are making my patients sick, aren't they my responsibility to address too? Or, I wondered, is this where I should be asking for the serenity to accept the things I can't change? Whether I ultimately decided it was my responsibility out of wisdom or idealism, I'm not sure. but it was this sense of responsibility and a recognition that I wasn't equipped to make good on it that ultimately brought me here. Studying health policy helped me appreciate how my vocations as a physician and public health practitioner could extend to the political realm. Frankly, that they have to. And no matter your background or where you've landed after Harvard, I think the same can be said for all of us gathered here today. As it turns out, those of us working to improve the health of people around us have a massive advantage when it comes to engaging in political systems. Put simply, health opens doors that are closed to others. When my role model, Dr. Jack Geiger, was building one of America's first community health clinics in Mississippi in the late 1960s, he noted that they were able to, quote, to enter and to do things under the umbrella of health that would have been much harder to do if they'd said they were there for economic development or for social change. I think there is so much power in this realization because it positions anyone that strives for a healthier society as an agent of social change. It helped me realize that caring about public health was already a political act, that I could do even more by leaning into the notions that politics and public health are increasingly synonymous, and that social change is its own form of medicine. Because having the serenity to accept what I can't change is a luxury in a time when a pandemic entrenches centuries of health inequity, when the constitutional right for a woman to govern her own body is in question, and when lawmakers' willful inaction on gun violence means shooting after shooting in schools, supermarkets, and sanctuaries. So now, instead of reciting the Serenity Prayer, I think we should all look to a revision by Angela Davis for guidance. I am no longer accepting the things I cannot change. I am changing the things I cannot accept. This is the message I am taking with me as I say thank you. And congratulations again to the Harvard Chan classes of 2020 and 2021.